This is Daily Blast Live. We're talking about what you're talking about.
You all ready for this?
This is a sham.
No. Y'all, just stop.
Get real. Welcome to DBL. Happy Friday, everybody. I'm Jeff, once again in for Tori. Dr. Coley, welcome to the show. Very important that you're here today. We got a lot to talk about. So our original plan was to focus on health and wellness, of course, with Dr. Coley being here for the new year. But we're going to do that a little bit later in the show. But we had to start with some terrible news. I'm sure everybody at home has heard that Lisa Marie Presley, the only daughter of Elvis Presley, has died of cardiac arrest. She was only 54 years old. So according to reports, Lisa went into cardiac arrest at her home in Los Angeles yesterday morning. Her ex-husband, Danny Keough, and the paramedics did CPR and administered epinephrine to reestablish a pulse, but she later died at the hospital. Now, again, like I said earlier, luckily we have our very own Dr. Coley here to answer some of our medical questions about Lisa's death. But first, before we get to Dr. Coley out, how did you react hearing that news? Because we just saw her at the Golden Globes.
We just saw her, and honestly, you know, yesterday, obviously our co-host Steph was on the panel, and she was sitting in the chair that you are, and she just said Lisa Marie Presley has gone into cardiac arrest, and I just thought, isn't she too young? That was my first initial thought. Isn't she too young for that? And maybe that's why you're here, Doc, to kind of answer that. But when I heard that, I just got the feeling it wasn't good.
You know, a third of cardiac arrests happen in people under the age of 60. So believe it or not, I mean, she was only 54, so she's young. Generally, cardiac arrests happen more in men than in women. But women who have cardiac arrest, guys, most of them don't have a known medical history of heart disease. So, you know, we heard about Damar last week. We heard now about Lisa Marie. I had a patient yesterday in my office who went down. So I feel like cardiac arrest is a real thing. It happens every year, year after year, has a very high rate of mortality, 90%. So the more we talk about it, the more we can hopefully learn how to help somebody if we're in that situation.
All right, well, let's talk about, you know, the cardiac arrest. I'm curious, what's the difference between cardiac arrest and a heart attack? Because I feel like commoners like myself, they kind of think they're the same thing.
So this is a great question. So think about your heart like a house, okay? So the plumbing of the house is what goes wrong when you have a heart attack. So that's the blood flow that comes to the heart muscle. You have a blockage in the blood flow that can then cause problems with the electricity. Whereas the electricity going wrong is primarily what happens when you have a cardiac arrest. That's the rhythm of the heart. It can cause an arrhythmia.
And is that when you use the defibrillators?
That's right.
Okay.
So now if the pipe bursts in your house, it can cause flooding, which can then cause the electricity to misbehave. So one thing can sort of lead to the other. But the primary problem, what was it in, you know, was it a plumbing problem with blood flow to the heart muscle, or was it an electrical problem with the rhythm of the heart muscle?
So, you know, I'm going to go off script here a little bit because I've been reading things online, and a lot of people are just jumping to the conclusion that it has something to do with the vaccine. We've talked about this before, and having two of these cases so close to each other back to back. Will you put that to rest for us? Will you explain that? I know that this wasn't coming, but I know a lot of people out there are jumping on that train.
You know, once and for all, cardiac arrest is not related to the COVID vaccine if you don't have myocarditis. Now, let's say you had a complication of the vaccine, which we know a small percentage of people can get inflammation of the heart muscle, get scarring in the heart muscle, then yes, it could increase your risk for having a cardiac arrest down the line. But just to put things in context, you are far more likely, 11 times more likely, to have myocarditis or scarring of the heart muscle and inflammation from COVID infection than you are from the vaccine. So if we are seeing an increase in the number of cardiac arrests, a lot of that could have to do with COVID, because not only does it affect the heart directly, but it also affected people's ability to get to the hospital, to get care, to get their diabetes treated, to get their heart attack fixed. So that's what we're seeing, an increase in cardiac arrest since the pandemic because of that.
Right, and I wanted to just clear that up. I know we talked about that before, but I thought it was appropriate because now with Lisa Marie, everyone's kind of jumping to conclusions here. Erica, do you have a question?
Yeah, because I think this is probably more of a conversation that people should be having, and that's in terms of family history of heart disease and death. So Elvis died from cardiac arrest when he was 42. His mother died from cardiac or heart failure at 46, and all three of her brothers also died in their 40s from heart or lung complications. So is there a possible genetic component to this?
You know, I want to be clear, because the final common pathway of death is always cardiac arrest. So the last thing that happens before we pronounce somebody dead is their heart stops. right? Now, what caused that heart to stop? Like, let's say they smoked all their life and they have bad lung disease and then they have COPD and that's why the heart stops. That's not a primary problem with the heart. So sometimes when you say your grandparent died of heart failure, there could be heart failure from high blood pressure, from diabetes, from something else. The heart just kind of gives up because of other problems.
Right.
But if Elvis died of sudden cardiac arrest at a young age, or you have a cousin or a family member, anyone who sort of dropped dead, such as, for example, Damar's family, it is really important to look for genetic causes because these things do run in families. And what can run in families is problems with the electricity. So those are called congenital channelopathies. The way the electricity moves in the heart could be a congenital problem. And you could have a problem with something called cardiomyopathy. So the way the heart muscle is formed when you're actually, inside your mom developing, it could have a problem with it. So there are different types of cardiomyopathies. Nowadays, thankfully, we have genetic tests that we can do. So we can do a simple blood test that'll tell us whether or not we might be at risk for developing some kind of a congenital heart problem, either with the electricity or with the actual pump itself.
I do want to ask about that because my husband and I have done a lot of genetic testing, and because of our backgrounds, like nothing really lines up. Like we don't have the same things at all. But do you suggest that people who are thinking about conceiving and growing their family, do you suggest genetic testing for just anyone?
It's a conversation to have for sure, Erica, because anytime you're thinking about having a baby, you want to think about the baby's risk proactively because health actually starts before the baby's even conceived, if you think about it. But you have to be a little careful because it's a tiny bit of a double-edged sword. The minute that you have a genetic diagnosis, it can affect your insurance premiums, it can affect your health insurance, your life insurance. So you have to make an educated, informed decision. But certainly if you have a family history of any kind of family member dropping dead, and I encourage a lot of my patients who come to me and say, my cousin died suddenly at 45, get that genetic test because it could change your behavior today. That could change the trajectory of your life tomorrow and for years to come.
All right, and Doc, I'm going to jump in here. We only have 30 seconds, and I want to make sure I give this question the respect that it deserves, but also needs to be said because I don't see any shame in somebody struggling with drugs and alcohol. And it's been, I consider it a disease, and it's no secret that Lisa struggled as well. Do you think that this had anything to do with her passing, or could this be something else that you would talk to your doctor about? Like, I do have a history of this in my past. Could that later catch up with you later in life?
In her particular case, we don't have a lot of details, so I'm going to speak a little more generically.
Please.
But when I have patients who come in who've struggled with whether it's opiate addiction or meth or cocaine or anything, that can damage that heart muscle tremendously. And it can cause that scarring that disturbs the electricity even years later. So I'm thinking of a particular patient who actually has been clean for 20 years and has had arrhythmias, had to get a defibrillator because she has scar tissue in her heart from something she did 20 years ago. So please be honest with your doctor about it. And there's no shame in it at all.
Absolutely.
It's something that you need to just talk about as one of your medical problems.
Al, thanks for sneaking in that 30-second long question.
Hey, there we go.
All right, coming up on DBL, Dr. Coley is going to stick around. We need to laugh a little bit, right? To talk about weight loss in the new year. Could weight loss drugs like Ozempic be for you? Plus, busting medical myths. Is organic food always better for you? Stick around.
It's a new year, and DBL is all the talk.
Let's get it going.
We had a lot to talk about last year,
I'm flexing every day.
and we're not stopping in 2023.
I'll see you guys on the flip side.
We are talking about
We're talking about
just
medical
issues
myths.
with
So they'll throw stuff out. You can
your heart,
participate
and
as you wish or not.
Dr. Coley
You have
really
one
broke it down
question.
for me
It's not
because
like you and her.
it makes sense that like when you
question?
hear that people in your family, because I have a history of heart disease in my family, when you hear
goes
that
this year, you
people
are
die
going
from
to
cardiac
college,
arrest,
you're
I
setting
didn't
your
know that
average
that's
is
kind of
20
how
pounds
everybody
a
dies,
year.
but it's the things leading up to that can be the real cause of death. Eric, I know you've done genetic testing, and I think for myself, you're always scared, because you don't want to hear, I have a history of cancer in my family, high blood pressure. I've been to Dr. Coley's office, and, I've been on the statin ever since I left her office, but these are all things that you should get ahead of, even if you're a little worried, because I definitely was.
And quickly, how many people don't want to get that test because their insurance might go up because you know, because of something they found in the test, they're like, I'm not going to do that. I don't want my insurance to go up. I can't even afford living as it is right now. So I think a lot of people, that turns them off.
Maybe for genetic tests, but not for calcium scores. So when it comes to heart disease prevention, insurance companies want to pay for that because it's the #1 killer. So if they can prevent your heart attack in 10 years or 20 years, that actually makes sense for them to pay for your statin now to prevent that. Because the heart attack's going to be a lot more expensive than your generic statin medication.
Yes, my statins are like free, I think, with my
That's
copay.
right,
I was like,
that's
oh,
right.
yes, I know they're not doing this because they like me a lot. Yeah, they must work, and they're like, don't have a heart attack because we don't want to pay for that.
I will
Yes,
say
get on a
about
statin.
the genetic testing, like in our family, so we knew that I knew I was a carrier based on our family history of something that's super common in African Americans. And the truth is, I see it from the side of having family members who have it. So I wanted to be sure because it's preventative. So if there's things that are preventative, that's another good reason to get genetic testing.
Welcome back to DBL. If you have weight loss goals this new year, you are not alone. So according to a new study, Americans on average want to lose 29 pounds in the new year. That seems like a lot of weight. So we got to ask Dr. Coley, she's still here with us. Is this even possible or reasonable for someone to lose that much weight in a year?
It is possible, and it is actually very reasonable. And, you know, of course, we want to lose weight as quickly as possible because we want to look good and feel good, but it's important to do it at the right pace. So they say about 1 pound a week. So if you think about 52 weeks in a year, that's probably reasonable. But I want to say that it depends on where you start. So if you're a 140-pound woman, you want to be careful because that may be too much weight loss. And we know that there's what we call a U-shaped relationship with weight and risk of dying. So if you're too skinny, it increases your risk of dying, and I'm talking about a body mass index below 19. And if you're overweight, which is above 25, it increases your risk.
Below 19 is dangerous?
Yes, because you have less muscle.
I'm feeling good.
Yeah.
What's your number, Jeff?
I don't know. I think it's over 19. But yeah.
I know mine's over 19.
Yeah.
Sure. So, you know, Doc, go ahead and just figure this out for the world. What diets actually work? Because I think we all want to know, along with exercise, what diets actually work if you stick with them?
You know, what we put inside our body matters, whether we live or die. So there's a new study that just came out just a couple days ago from Harvard, my alma mater.
Shout out.
Yeah.
Wow.
which
you
said,
dropped something there, Doc.
Yeah.
No, it's good. I would too. I'd say I'd wear a H on my chest.
Exactly. I'd have the sweater.
MIT is my real alma mater.
Oh,
Harvard
just
is
MIT.
sort of the fake one, you know.
Oh, wow. Doc, you dropped something there.
Yeah.
I'm just kidding.
But basically what they did is they looked at 4 different diets. And everybody who stuck to these diets did fine. And honestly, they were all different. One was plant-based. One was what's called Mediterranean, which is like fish and olive oil, avocados. And then, you know, one had a dietary index, which counted how much alcohol you had. And it doesn't matter. The bottom line is, if you're eating fruits and vegetables, legumes, nuts, the healthy oils, it will reduce your chance of dying by 20%.
Wow.
Yeah, so it's actually really compelling data. I mean, you know, if any of us was on our deathbed and somebody asked us, oh, you know, if you changed your diet, you had a bigger longevity, would you do it? I think every single one of us would say yes.
I'd be like, why are you asking me that? I'm on my deathbed.
Yeah, way to rub it in.
Yeah.
So there are several FDA-approved weight loss drugs that are getting a lot of attention. So what are your thoughts on these types of drugs?
Yeah, so I think we realized in 2023 that obesity or having excess weight is not just a lifestyle choice. It's not just you being lazy, but it's a medical condition. And we need to treat it as such with appropriate drugs. I think these drugs are amazing. I think for the right person, and I want to emphasize the right person, it is really a game-changing thing because not only does it help you lose the weight, look better, feel better, but it also improves your cardiovascular outcomes. Now, my mom came to me the other day and said, can I have a prescription for one of these drugs? Because I'm going to drop a few extra pounds and I don't want to exercise. Mom.
Don't say that to your doctor. You can think it, don't say it.
This is not a replacement for healthy dietary patterns. This is not a replacement for what we said, which every plate should be half fruits and vegetables, a quarter, protein, a quarter carbs, and the exercise. This is an adjunct for those people that have hit a wall. Doctor, I'm doing everything I can, and I can't get the weight off, and I'm not able to stay.
So you don't necessarily have to have diabetes to take this?
No, in fact, it's FDA approved for obesity, with or without diet.
Okay, just to be clear.
Yeah.
So, okay, I have some thoughts on this, but I'll stick to the program because apparently there is an issue with people who need this drug getting it because people are using it recreationally,
You don't
so to
say
speak.
Erica.
Yes.
Yes.
So for anybody thinking about that, and I'm not judging, I'm just saying that's what happened, y'all. What are the side effects of these drugs, and how big of an issue is this for people who actually need them?
They're not bad. The side effects are really not bad. So they change the way the satiety works in our brain. And it's a once-a-week injection. We inject ourselves, and it changes the way the signal triggers in the brain. So initially, you might feel some nausea. You might have some diarrhea. Most side effects were mild, and most of them got better with time. So side effects is not the reason people stop this drug. It's mostly the cost. And I'm glad you brought up the diabetes thing, Erica, because as a physician, it's a real struggle for me, because diabetes is an illness, and it needs these drugs. But obesity is an illness, too, and it needs these drugs. And so I think, again, going back to the point that they are FDA approved for both indications. I'm not saying one is more important than the other, but I also don't want people who just want to lose some weight for a wedding or for a vacation to use this recreationally, because that's not the intent here. It's for people who have real medical obesity.
Yeah, definitely. So, well, I have some questions. My wife took it, had a little side effect. She's off it now. She was hoarding all the people for all the people who need it. She's a hoarder. All right.
I'm not judging.
Thank you, Dr. Coley. Coming up on DBL, we're sticking with the New Year, New You theme, busting medical myths. That's next.
According to the latest data from the CDC, almost 20% of kids and teens ages 2 to 19 are obese. That's about 14.7 million children. We spoke with a doctor about these new guidelines and are getting you the facts. Our source is the American Academy of Pediatrics, or AAP, pediatrician Dr. Soren Johnson with Novant Health, Robin Hood Pediatrics, and the CDC. According to the CDC, 12% of kids 2 to 5 are clinically obese, and it only gets worse from there, with 20% of kids 6 to 11 suffering from obesity.
This is something that's kind of accumulated over years, and the percentages just keep moving up.
So let's take a look at those new guidelines. They recommend initial interventions requiring upwards of 26 hours over 3 to 12 months of intense in-person behavior and lifestyle treatment, which include coaching on nutrition, physical activity, and changes in behavior. AAP states this approach should be used for kids 6 and older, but it could be used for those as young as 2. After intensive therapy, the AAP states weight loss drugs should be considered for adolescents as young as 12 years old, and 13-year-olds with severe obesity should be evaluated for weight loss surgery.
They are trying to bring that to the forefront and say, look, we should be talking with our patients at a younger age and considering this. It used to be kind of 16 years old and up that we would consider that bariatric surgery as an option.
Dr. Johnson says medication and surgery would be used in extreme cases, and it's important for families to speak with their doctors to figure out what's best for their children. With your Verify Fact Check, I'm Megan Bragg.
Welcome back. We all know that medical misinformation spreads so fast these days. So today we invited Emmy Award-winning journalist, medical doctor, professor, and author, Dr. Seema Yasmin, to talk about some medical myths. So Dr. Yasmin, thank you for joining us here on DBL.
Thank you so much for having me. I want to get into the myths. Debunking them is one of my favorite things.
Let's debunk. So you have a book called Viral Bleep, Medical Myths and Why We Fall for Them, that dissects some of these medical myths we're about to talk about. So let's start with this one. Mammograms cause more problems than they detect.
So shouldn't this be the most straightforward thing when patients say to us, hey doc, at what age should I start getting mammograms and how often do you recommend them? Unfortunately, it's not so straightforward, and what's happening is different medical organizations are recommending people start at different ages and get them at different frequencies. Some will say start at age 40, get a mammogram every year. Others are like, no, thank you, because mammograms might be causing some problems and overdiagnosis for some people. Please wait till you turn 45, then get a mammogram every year. And then we've even got other medical organizations saying, wait till you're 50 and then get a mammogram every other year. Now, I'm a public health doctor, so basically cancer screening is like our religion. We love the idea of patients catching a cancer as early as possible. But we have to talk about some of the downsides of screening. And that is the problem, where we sometimes catch things that we're worried might turn into a cancer, but never do and never will. And that's where this word overdiagnosis and also overtreatment comes into effect. And you can basically send a patient down this horrible long journey of biopsies, then another test, then more screening, more biopsies, or to find out that they didn't actually have a cancer in the first place. And just quickly, I'll give you an example that when it comes to cervical cancer screening, for example, if we're doing that very frequently, we see something on a patient, we're worried about it, we might go to that extent of removing a small part of their cervix. And we're doing that, of course, with really good intention, but we have to be so mindful of the consequences downstream. And what can happen for some patients is that action, that biopsy, might make it more difficult for them to hold a pregnancy to term in the future. So that's why my best advice is get screened for cancers, but do your own risk assessment. Don't get so confused by the different opinions of the different medical organizations that you kind of get analysis paralysis and just don't get screened at all. But talk to your doctor about what's the best course of action for you based on your personal history, your family history, and your lifestyle, and take it from there.
All right, Doc, we got time for one more question, and I want to ask you about this. Older adults are at risk of contracting STDs or STIs. How is this possible? Honestly. I thought we'd be talking about college kids or something, you know? I'm sorry.
We know how it's possible, Al.
How does that happen, Doc? In your medical opinion?
I won't go into the details of that part, but I'm so glad you asked this. And part of the problem was we're not talking about older adults having sex. And in fact, when I was researching this question for my book, I was finding that some of the studies on this, they end when people turn to 55, as if people stop having sex when they get to their 55th birthday. It's not true. But what happens is doctors kind of stop having that conversation with people when they get to a certain age. They make all kinds of weird assumptions. So they're not talking about the basics sometimes of safer sex. So what we've seen over the past few years is rates of infections like chlamydia, gonorrhea, even HIV increasing among older adults because they're not getting those frank conversations and that helpful advice.
Well, Doc, thank you so much for clearing it up. We're like children around two medical professionals around here. But thank you so much. We got to have you back when we have more time. To our viewers, check out Dr. Yasmin's new book, What the Fact. It's actually behind you over your shoulder right there, Finding the Truth in All the Noise. And for more medical myths, you can get Dr. Yasmin's other book, Viral Beep, Medical Myths and Why We Fall for Them, wherever books are sold. Again, Doc, sorry for the short time, but we appreciate it. Thank you so much.
Thank you.
Thank you.
We'll be right back.
One in 3 homes has a natural gas stove in the kitchen, and a new study links childhood asthma to the appliance. So there was a lot of confusion on social media when headlines claimed the federal government is considering banning gas stoves in response to the study. So let's verify. Is there a national ban on gas stoves in the U.S.? Our sources are the Consumer Product Safety Commission and the White House. The CPSC is an independent government agency that regulates the manufacturing and sale of some consumer goods, like stoves, in the U.S. The gas stove controversy started earlier this month when a CPSC commissioner said in an interview that the agency is considering a gas stove ban. Soon after, the head of the CPSC issued a statement saying, "I am not looking to ban gas stoves." And the commissioner who made the initial comment tweeted a clarification that the CPSC is not coming for anyone's gas stove. So, no, there is no national ban on gas stoves in the U.S., and the White House says it has no plans to do so.
The president does not support banning gas stoves, and the Consumer Product Safety Commission, which is independent, is not banning gas stoves.
However, some cities like New York and San Francisco have banned new natural gas hookups for things like stoves in most future construction projects. But people who currently have gas stoves do not have to replace them. With your Verify, I'm Brandon Lewis.
Are you skeptical of headlines and what you see on social media? We are too. The Verify newsletter helps you distinguish between true and false information by answering your questions. It provides fast facts on trending topics, spotlights major stories, and even includes a daily fun fact for all those trivia buffs out there. Get Verify's fast facts delivered every weekday to your email inbox.
The Mega Millions jackpot is more than $1 billion. The prize is now the second largest in Mega Millions history. That's got people racing to buy tickets, but as you try to get rich quick, be careful because scammers may be trying to get rich off of you. Let's verify. Are there lottery scams around large jackpots like the one in Mega Millions? Our sources are Mega Millions, Powerball, the Better Business Bureau, and the Federal Trade Commission. Scammers have a history of targeting people who play lottery games, including Mega Millions and Powerball. On its website, Mega Millions warns of one particular tactic, a phone call, text, or email informing that you've won and asking for either payment or your personal information to claim the prize. And you don't have to buy a ticket to be scammed. Mega Millions also warns scammers could claim to be past winners looking to share their money in exchange for information. Both Mega Millions and Powerball say they do not reach out to prize winners. The FTC and the Better Business Bureau say signs of a scam include being asked for personal information or to send money to pay fees or taxes on the prize. So, yes, there are lottery scams, particularly around large jackpot games like Mega Millions. Our sources recommend contacting your state's Attorney General and the FTC if you think you've been scammed. You can report scams to the FTC by going to reportfraud.ftc.gov. With your Verify, I'm Brandon Lewis.
Woo! Winter weather is in full swing, and if we got tips on what to keep in your car in case of an emergency, that's today's Auto Alert, sponsored by Ox Car Care. First, pack a thermal blanket in your survival kit in case winter conditions leave you stranded. Next, make sure you have a phone charger in your car to keep your device powered so you can call for help. And lastly, have an ice scraper and de-icer so your windshield and windows can be cleared before hitting the road. Ox Car Care is dedicated to providing you with an amazing auto protection plan experience that works with your budget. If you're looking for better car care, give them a call today at 800-687-1821.
Yes.
All right, we were busy chatting between the break, and then I got caught on camera.
And also a little fun fact, you want to scrape the snow off the roof of your car as well because it can blow back in the person behind you.
Wait, on the hood of your car?
No, the roof of your car. You know, like if your car's buried.
Yeah.
Knock that snow off as well because it can cover your back window and get the person behind you as well if you're going fast.
Be a good neighbor.
That's right.
Wow. All right, there you go, Doc. Some professional advice from Dr. Jackson there.
Look, we can take it to professionals, Chef.
But Doc, really, thank you so much for coming in today. We really appreciate your medical opinion. Have a great weekend, everybody. We'll see you on Monday.